Hi friends, welcome to Charkos. I'm Dr. Seema Balian, the founder and director of Charkos. Charkos is a healthcare recruitment and training company with over 15 years of experience in providing turnkey solution for training and recruitment needs for the nurses, doctors, and AHPs such as radiographers, occupational therapists, ODPs, and many more. Charkos operates over 3 continents in countries such as UK, Australia, Germany, Italy, and New Zealand. Our services include OET and IELTS training, CV enhancement, interview preparation, NMC and APRA registration, CBT and NCLEX preparation, visa application and flight bookings, OSCE training for all fields of nursing such as adult nursing, mental health nursing, pediatric nurses, midwifery, and learning disabilities. OSCE training is available in India as well as in UK. Orientation for life in UK. OSCE exam bookings and the logistics bookings. Excellent pastoral care. Our state-of-the-art learning platform includes reading materials, videos, quiz to enhance your learning and equip you for a positive and a better outcome. For registration, CV upload, relevant bookings, and more information, please visit our website www.charkosglobal.com. Visit our YouTube channel and subscribe our YouTube channel by going to Charkos Learning Center, our Facebook page, Instagram, and LinkedIn pages by the name of Charkos Global. So, what are you waiting for? Subscribe now. Press the bell icon for regular updates and all the information that you require. We are looking forward to seeing you on our site and being a partner in your enhanced journey. Thank you very much.
Hello everyone, I'm Dr. Seema Balian, and today I will be talking about new NMC OSCE. Now, as all of you know, that the NMC OSCE has recently undergone some changes, and hence it is called as the new NMC OSCE. So these changes came into effect from August 2021. And according to that, you will be requiring to appear in 10 OSCE stations rather than the 6 OSCE stations that you were giving in the old OSCE exam. So in this presentation, I'm hoping that I will be able to give you a better idea of what this new OSCE exam comprises of and what are the various aspects of it, what to expect, and hopefully you will be more confident at the end of this presentation and you have more knowledge about this new OSCE. So let us get on. So what is the new NMC OSCE? Now, when we say new NMC OSCE, I'm sure that you must have heard this name a few times, and you probably all of you would understand what an OSCE stands for as well. But let us just clarify that what exactly is OSCE and where does it appears in the process of the registration. So basically, for your NMC, for you to work as a registered nurse in UK, you have to broadly you have to go through 3 things or 3 type of an exams. The first one being your English language exam, which all of the international nurses need to give, and you need to have a certain score to be able to be eligible to apply for the NMC registration application. The second is CBT, which is checking the theoretical aspect. And the third one is OSCE, which is checking your practical knowledge in order to be a registered nurse in UK. So it stands for Objective Structural Clinical Exam. As I have already said that from August 2021, this exam, the OSCE as well as the CBT have changed a little bit. And now there is various aspects which are checked in the CBT and some other aspects which are checked in the OSCE. So earlier you needed to give one paper of CBT, but now the exam is divided into 2 parts where it is numerical as well as the clinical side. Focusing more on the OSCE in the old exam, which was conducted for anyone who have appeared for their CBT before August 2021. So the old exam comprised of 6 stations, but as per the new OSCE, now it has 10 stations that you will have to appear in. So currently this exam is taken only in UK, the OSCE exam. The CBT is conducted in various part of the world, but the OSCE exam is only taken in UK. Now there are various centers in UK which conduct this exam. Mainly there are 3 centers at the moment, but it has already been announced that there are 2 more centers which are being added from next year. So there will be in total 5 centers from next year. So those 5 centers are Northampton University, Oxford Brook University. Oxford Brook University has 2 campuses, Oxford campus and a Swindon campus. Then Ulster University, which is in Northern Ireland. Then the new ones are Leeds Teaching Hospital and Northumbria University. So in order for you to appear for the OSCE exam, we will be booking your OSCE in any one of these test centers. Now, what to expect in a test center? Now, majority of the test center, although they are in different locations, but once you are in there, there is an care which is taken to make sure that all of the OSCE centers, they have a similar looking exam area, so that we maintain the continuity as well as the same type of the environment for all of the exam centers. So basically you will have that there is going to be a patient bays which are there for each individual stations. There is an examination area which is overseen by the invigilator. In each bay, there is an assessor who is going to be marking you while you are doing any of your exams. There is an area in the outside where in the waiting area where you will be able to familiarize yourself with the equipments before the exams. And all of the exam is recorded for the moderation and review purposes. You will also be required to take all the COVID precautions, and hence you will require to wear the mask during the exam. If there is any actor who is playing as patient in any of the stations, then you will also be required to wear PPE, which is going to be that you will need to wear gloves and apron along with the mask. This is a typical setup. As you can see that there is a timer, there is a patient's bed along with a mannequin, and there is a table and a chair where the assessor can sit. There is a hand wash area, and there are some clinical and domestic waste bins. So majority of the time, this is how a bay is going to be set up. This is another example of similar looking setup. So as you can see that it is almost the same as the other one. So the utmost care is taken that it is not different in different exam centers. Coming to the equipment, all of the equipments that are used are very common and standard equipments. And I'm sure that you would be familiar with most of the equipments by working in your day-to-day professional life. But when you will come to face-to-face training at the Aryabrat Training Center, we normally will be using all of the equipment which are there in the NMC equipment list. And hence, you will get familiar with all of the equipments before you appear for your exam. These are some of the common equipments. You can see that there is a pressure gauge for oxygen, there is a call bell, there are some bedside controls, there is a BNF. For BNF, nowadays it is an electronic BNF which will be given in a tablet form to you, so you can actually search quite easily if you need to look up for any medication. Some other things like the dressing, the blood pressure monitor, the pulse oximeter, and some of the common things. I'm sure that you all would be familiar with all these equipments. Now, a little bit more detail about this new OSCE exam. The OSCE exam is going to take around 3 hours for you to complete the exam. As we have already said, that it comprises of 10 stations. Now, these 10 stations are made out of 4 stations from the APIE and 2 pairs of 2 stations of skills and 1 professional values and 1 evidence-based stations. So the professional values and the evidence-based stations are also the new stations which have been introduced in the new OSCE. You will, on the same day of the exam, You will also get all of your original documentation check done, so that that can be ticked off in your NMC portal, so that your application can move forward. Result, normally it says that it can take up to 5 working days, although majority of the time it comes before that. And the result is usually you will get an email saying what your result is. You can also check your NMC portal because the result is also updated over there. Once you pass your OSCE exam, you are then put up for the issuance of the PIN number. It can take around maximum of around 30 days if there is no other query which comes on. Sometime there might be some query or some additional information which the NMC requires. So please be aware that you will receive an email if they require any additional information. So kindly do keep on checking your emails. So now going in a little bit more detail, that if we look at the API station that I was talking about. So API actually forms 4 stations. So, and these are, A is for assessment, P is for planning, I is for implementation, and E is for evaluation. So this is, these 4 stations are done for you to be checking a patient. So, and it is the same patient's journey that you will be following through all these 4 stations. So, there are different times for all of the stations, but we will go through the times as well. And you will not get any extra time for these extra time to read the scenario. That you will have to keep in the scenario itself. You will need to read, but then it is only an A4 sheet that you have to quickly go through the history and quickly read the scenario. So it should not be taking longer time. Now, API always happen in the same sequence because it is the patient's journey that you are taking forward. So there is always going to be assessment first, then planning, then implementation, and then evaluation. But with every station, you will get an update, because in actual day-to-day life, they do not happen so quickly. So that is why you are going to get an update for every step. So after you have done an assessment and then you start writing your planning, you will get an update scenario that now this is the update of the patient's journey, and accordingly you are going to be writing your planning, implementation, and evaluation. So it is, so assessment, as I said, that you are going to do assessment. In the planning, it is a silent station, and you will need to write down 2 problems with 1 care plan. Normally for this station, for the assessment and implementation station, you are going to get an actor who will be playing as a patient. Now, going a further detail of the assessment, normally you will be given 20 minutes to complete the station. You will be given a brief history on the A4 sheet. And for the assessment, you will have to go through the brief history as well as doing the vital examination of the patient. And the vital examination are going to be including a ABCDE assessment. By A, I mean airway assessment. B is for breathing assessment, which you will have to check the respiratory rate. C is for circulation, where you are going to be checking the pulse, BP, and the capillary refill. D is for disability, where you are checking the patient's consciousness level. And E is for exposure, so you will be checking the temperature of the patient. Now, once you have taken all these vitals, you will need to complete a news chart. News chart is the National Early Warning Score chart. So you will have to plot all of your vitals in that chart, and according to that chart, you will have to then come up with a score. The score is going to then tell you what is the monitoring frequency. You will need to write down that monitoring frequency in the chart as well, and then you will need to also decide that whether the score is something that you are worried about, and hence you need to escalate the care further, or you do not need to escalate. And last but not the least, you will need to initial or sign in the news chart. And as I have already told you, there is going to be an actor for this station. So it is the actual readings that you will need to take. There is not going to be any flashcard. So the assessment can be of 2 types. It can be in hospital setting or it can be a community setting. And the scenario can be slightly different of what you are expected to do in the hospital setting and what you are expected to do in the community setting. But in principle, it still stays the same, that you still will require to take a brief history of the patient and do all the vital signs and complete a news chart. Sometime in the in-hospital, if the patient is suffering with head injury or some neurological thing, then you might, instead of the news chart, you might have to do a GCS chart. But otherwise, you will need to complete the chart. In the community setting, along with the chart that you will be completing, the news chart, you will also need to do an assessment of either MUST, which is a malnourishment tool that you will need to use, or you might need to do a PHQ-9, which is a tool which tells about the mental state of the patient. You will also need to make sure that once you have completed your charts, that you check with the patient the activities of daily living, such as the eating, drinking, mobility, the diarrhea, constipation, their social history and all that. All this history is going to help you to take better care of the patient. So this will also be included in the assessment. And also, all the while when you are doing the assessment, your verbal as well as the non-verbal communication is also checked. So please make sure that you talk to the patient and just behave in the same way like you would be doing in your real life. So assessment, as I had already told you, that in hospital setting, either you can get a news chart or a GCS. GCS is more for patients with head injuries or any neurological problems. And in the community setting, you will need to complete a news chart. And along with it, there might either be a MUST scenario or there might be a PHQ-9 scenario. Now, I'm just going to quickly show you how all these charts look like. Of course, like we will be discussing these charts in much detail when all through the online sessions as well as the face-to-face training. But please have a look to just get familiar that how these charts look like. So this is what a news chart look like. Now the news chart, as you can see, that it comprises of all of the A, B, C, D, E aspect. And you will need to complete this chart depending upon what are the vital signs or observations that you get. You will also notice that this chart has some color coding. So the color coding depends upon whether the vital observations are normal or abnormal. And if they are abnormal, then how abnormal they are. Yeah, so the degree of severity is also there. So anything in white color is normal. So you will give a 0 score for that. Anything in yellow is abnormal, but only mildly abnormal. And that's why you give a score of 1. Anything in orange and then going to red is obviously the severity of the abnormality increases, and hence you are going to be giving the score accordingly. Once you have done all of the plotting of all your vitals, then you are going to calculate the score according to the color and then decide whether what is the monitoring frequency according to your total score. Then decide whether it needs to be escalated or not, and then write down your initials. So if you will see in the bottom, all these 4 things, you will have to complete these ones. So this is how a GCS chart looks like. In the GCS chart, you will also need to complete a GCS score by asking various questions with the patient and come up with a GCS score. I'm sure that all of you would have done it at some point in your professional life. So I'm not going to go in much detail of that one. But along with that, you will need to also plot the other vitals which you have already taken, which are the blood pressure, pulse, temperature, respiratory rate, and some other neurological observations such as the pupils and the limb movement or the strength that you will have to check. Then we come to the malnourishment universal screening tool, or the MUST tool. Now in the MUST tool, you will have, this is a tool which we use to check that what is the risk of the patient for malnourishment. Now it can be, again, dependent upon the score, it can be a low risk, medium risk, or a high risk. And in order for you to get the score, we need 3 things that we need to check. We will need to check the BMI of the patient. We will need to check the weight loss in the last 3 to 6 months of the patient. And also we need to check the acute disease effect score. By acute disease effect score, I mean that if the patient have been acutely ill or have been nil by mouth for the last 5 days, then this is going to be relevant. Although in your actual practice, you will be able to see that anyone who is in the community is unlikely to be having this acute disease effect score. So it is not going to be applicable for them, because if they are in the community, then it is highly unlikely they are acutely ill. And also, if they are in the community, it is very, very unlikely that they are nil by mouth for more than 5 days. So, but yeah, this is what we are going to be checking, that once we have completed all these 3 sections, we are going to get a total score. And depending upon the total score, we are going to decide that whether it is a low, medium, or high risk. Date, time, and signature needs to be done. And then depending upon the risk, you will need to explain to the patient that what is going to be the management and what are the instructions that you will need to give to the patient. So then the last of the charts is the PHQ-9 chart. In the PHQ-9, basically it stands for the Patient Health Questionnaire. So it has 9 questions, and in these 9 questions in some ways are asking about the patient's mental state with regards to his mood, and it helps us to decide that whether the patient is actually suffering with a depression. Now, this is something that we always, all of the questions have to be answered by the patient, considering that whether he or she have been feeling like this over the last 2 weeks. So it does not tell the mental state of right this moment. It tells us about the mental state of the last 2 weeks. So normally in the exam, this is already going to be completed, or at least it is going to be marked, and you might need to just total out that how much is the total score. And then according to the score, you will have to give your recommendation to the patient about the management. Okay, so that was all about the assessment. We will, of course, be discussing about each and every aspect of the assessment in more details in our subsequent sessions. So, but for the introduction, I think that this should give you a clear idea of what comprises of an assessment station. Coming to the planning station. Now, planning is a silent station. And when I say silent station, that means that there is no patient interaction in these stations. So all you have to do is that you will get a scenario and you will have to just sit and write down. Okay, so that is the reason it is a silent station. So the time given for planning is 14 minutes, and you will need to write 1 care plan with 2 relevant problems. Yeah, so, and these 2 problems, majority of the time you can decide while you are doing your assessment itself. So for example, if in the assessment you notice that patient is suffering with pain, or the patient is suffering with constipation, or the patient is finding difficulty in mobility, or the patient is having risk of deterioration, or there is a risk of infection. So all these are the type of problems that you can already know when you are doing the assessment. So by the time you reach your planning scenario, you should in your mind already have 2 problems which are the ones which you will need to handle as the next step in the planning. So you will need to use a black pen to write these 2 problems. So it is an A4 sheet which is given to you, and you will have to write 1 problem on one side of the A4 sheet and the second on the second side of the A4 sheet. So it is not that you have to write lots about it, because you do not have that much time. It is only 14 minutes that you have for 2 problems. So please make sure that you pace yourself correctly and you give equal time to both the problems, and keep the problems simple, and try and write the intervention in such a way that you are achieving your goals by those interventions. Try not to rewrite or overwrite or cross out, but if you have to do that, then please make sure that you mark with a single cross and do an initial on the top. And it is very, very important that your handwriting is legible, because if no one is able to read, then they are not going to be able to mark. Please do not use any abbreviations which are not standard abbreviations. Yeah. And also remember, it is the patient's care plan that you are writing. So please do mention the patient's name over there, and please mention the correct name and correct gender as well. Yeah. So I'm sure that once we go through in detail of the care plan, you will understand it much better. But this is basically what a planning station is going to look like. Then we come to the implementation station. Now, implementation is the station where you are actually going to be giving the medication to the patient. Now, in the patient's journey, if you have seen, you have already done the assessment, you have planned the care. Now it is the time when you have to actually dispense the medication to the patient. So majority of the time there is an actor who will be playing as a patient. You will get 15 minutes to complete this station. And although it is important to be organized and thorough in all of the station, but over here it is one station where you have to be even more careful, because it is actually a medication that you are going to give to the patient. So you do not want to make a mistake or give any wrong medication to the patient. Yeah. For this station, knowledge of medication is very important, because unless you know what is correct, you will not be able to figure out what is incorrect. So during the our training, we would already be sharing with you the list of the medication, and then you will help you to memorize those medications as well. But you will still have a BNF, which is going to be handy in the exam. So just in case if you come across any medication that you are not familiar with, then you can always check the dose or about the medication in the BNF. Evaluation. So evaluation is a station where you will be required to give a verbal handover of the patient using the S-bar technique. Now, I'm sure that all of you would be used to giving the verbal handover of the patient in your day-to-day professional life, because that is something that you do when you are changing shifts. So it is similar to that, but a little bit more structured. So we are using an S-bar technique for that. And by S-bar, it means S stands for situation, B is the background, A is assessment, and R is your recommendation. You will be given 8 minutes to complete this station. And you will, in that 8 minutes, usually people take 5 minutes to do the writing bit, so that they can write down small points about the situation, background, assessment, and recommendation. And in the next 2 to 3 minutes, you can read it out and give a handover to the patient, to your colleague. And that is what you will be doing in evaluation. Now that completes our API, 4 stations of API. Now I just want to go quickly through what are the skills which are there. So there are 16 skills in total that are there. And out of these 16 skills, you will get 2 pairs of 2 skills which you will have to demonstrate in the exam. Now the pairing, it is not necessary that it is going to be a set pairing that you will get. So it is quite possible that you end up doing 4 stations which are totally different. So please be prepared. Don't think that there is going to be a fixed pairing that you are always going to get. It is possible that you will get 3 stations as a verbal station, and 1 station you can get as a silent station, or it is possible you get 2 silent station and 2 the verbal stations. Yeah. So be prepared for and practice all of the stations, and you can get any 4 out of the 16. The time duration for all of the skills, it is different depending upon what skill you are doing. But for any 2 skills that you will be doing, it is around 16 to 20 minutes that you will be getting. And also, although API is always together, but the skills can be either before you do your API or after you do your API. And almost all of the skills are done on a mannequin. Now, these are just the skill types. So as I mentioned that there are 16 skills. So this is the list of all of the skills. So there is a BLS is one of the skills. You will get 6 minutes to do that. Blood glucose monitoring, you get 8 minutes to do that. ANTT and wound assessment is normally paired, and you will get a total of 21 minutes. But if they are separate, then ANTT is normally for 15 minutes and wound assessment is for 6 minutes. Then you will have 3 urinary stations, which are MSU, CSU, and ROC. That is the midstream urine specimen, catheter specimen of urine, and removal of catheter. And you get 8 minutes each for all 3 of them. There are 2 injection stations. One is the intramuscular injection and one is the subcutaneous injection. And you get 12 minutes to complete these stations individually. There is insertion of fine bore NG tube or nasogastric tube. You get 12 minutes to do that. intravenous flush and VIP assessment. You get 8 minutes to do that. There is pressure area assessment, which is a silent station. And in this, you will need to complete a Braden's score. And also you will need to go through what are the most common areas where you can get pressure ulcers, and also the initial signs suggestive of a pressure ulcer formation. Then there is pain assessment. You get 6 minutes for pain assessment. Wound assessment, as I said, that if you are going to get wound assessment as a separate station, you will get 6 minutes for that. Then there are 2 education stations, which are peak flow and inhalers. So you get 8 minutes for peak flow and 12 minutes for inhalers. And then there is fluid balance chart, which is again a silent station, and you get 12 minutes for that. So as I had this, so that completes our skills stations, all the 16 skill stations. We will, of course, individually will be going and practicing all the skills subsequently in our training. Apart from the skills, there are 2 additional new stations which I had spoken about earlier in the presentation. The first one is the professional values. Now, it is very, very important that we understand what exactly means by professional values and what are these values and what the examiners are expecting you to write in that. This is a silent station. You are going to get 10 minutes to complete this station. There are 5 topics over which these you will be checked, but out of those 5 topics, you are only going to get 1 topic in the exam, and you will be getting a scenario which is going to describe that topic which we have been talking about. And the scenario is going to create some kind of a dilemma in that scenario, and you will have to understand that dilemma and look up for the ethical and the integral aspects of that dilemma, and use your professional values to describe it and to write it down. So the professional values, again, in our reading material, which is already there in the portal, you will be able to go through all of the relevant things. What is the logic behind each of the professional values and what those professional values mean. So it is going to be very important for you to go through the reading material, do the quiz, and understand those professional values. Those values are based as per the NMC code of practice. So once you understand the logic behind all of those, this station will become very, very easy for you to write. Also, be very careful to keep on reading the criteria, because you need to know that what exactly are you supposed to do in that. So if you are able to read the criteria a few times, you will get a fair idea of what is expected from you to when you are approaching these stations. So you will require to document your observation in a bullet point, and please make sure that your handwriting is clear and legible. Again, you will get an A4 sheet in which you will have to complete. There might be 5-6 bullet points that you have to write. So it is not that you will have to write extensively. There is no specific word counts that you will have to write only these many words, or you can't, or you have to write some kind of a restricted word count, but you have a restricted time as well as the paper. It is, I don't think that you will be able to write that much that you are going to fill sheets after sheets. Evidence-based practice, again, the principle still stays the same as what I said about the professional values, but instead of the professional values, we are looking at the evidence-based practice. And I'm sure that all of you are already using and are used to the evidence-based practice in your day-to-day professional life, because in the current day and age, the evidence is available everywhere. And we need to be aware of the evidence which are there for many of the treatments which we are doing. So there are lots of journals, lots of research articles which are published, which keep on changing the management to make it even better and better as per the evidence which is coming up. So again, there are 5 topics, and out of those 5 topics, you will get any one topic to do in your exam. So you will be given a brief scenario, and along with that there is going to be given an abstract or a conclusion of a research paper which will be talking about the evidence which relates to that scenario, and you will need to go through that abstract and come up with what you have understood or what is the evidence, and you will need to write down your evidence and your understanding according to the criteria. So you will be required to again write in an A4 sheet in the bullet points and making sure that your handwriting is clear and legible. So of course, we will be going in much more details when we are actually doing our training and the practice. So this completes the 10 stations that we have already spoken about of the new OSCE. So 4 are the APIE, then 4 station of skills, 2 sets of 2 stations, and then 2 are for evidence-based, 1 evidence-based practice and 1 for professional values. So now just briefly about what are the common mistakes and error. I'm sure that everyone already knows that what are the common mistakes and error, but please make sure that your communication is really good and that you are actually talking to the patient, because it is not good that if you are if you have a back towards the patient and you are busy doing whatever you are doing and not even looking at the patient. Even though you are having a mannequin, please make sure to treat the mannequin as a real patient and talk to the mannequin. Also, make sure that you read and understand the scenarios and the instructions given properly so that you know what you are supposed to do. Time management is very important because you have limited time to complete that station. So please make sure that you pace yourself according to the time. So you should not rush too much and miss out on the things, but you should not linger on the things as well. Otherwise, you will miss out on some other things. There is a big timer which is there in every bay. Please make sure that you know where the timer is and that you are able to pace yourself according to that. Hand hygiene and infection control is again very, very important. And especially now in the COVID scenarios, so it is important that you follow the principle of hand hygiene. You know what are the 5 times when you should be doing the hand hygiene. And also you should know all the 7 steps of WHO hand hygiene guidelines. But also, please do not overdo the hand hygiene or under do the hand hygiene, because both of the things, if you are doing, it is almost saying that you do not know when to do the hand hygiene. So either you are doing in excess or you are not doing. So please understand the principles behind that, when you should be doing the hand hygiene and why it is important to do the hand hygiene at that time, and also follow your hand hygiene at that time. Please check for common things like allergies and patient identity. Although it seems so obvious, but there are still people make mistake in checking the identity of the patient. Now, it is going to be not a good experience if you have done a procedure on a patient without actually checking the patient identity, and then you find out it was the wrong patient that you did it. So please, that should be your first thing you should do, that check the patient identity and make sure that you are with the correct patient. Also, before you embark on any of the intervention, please take a consent from the patient. And that does not mean that you have to take a written consent for each and everything, but it is a verbal consent that you will require. Things like that: tell the patient what you are going to do and ask if it is okay, if they are happy for you to proceed. That is like taking a consent. Then last, in this one, please make sure that you have completed your documents correctly. Because if you have done so much, if you have done absolutely everything correctly in the station, but if you forget to sign, then it is almost like you're multiplying it by 0, because then it does not mean anything, because then we do not know that who has done this, whether it is valid or not. So in order to make sure that it is valid and you complete, unless you do the complete documentation, you will not be marked in the exam. So please make sure that you do the documentation correctly. In all of the station, if possible, keep around 1 minute or so where you can go through your documentation, where you can go through what you have done, and can it is kind of a revision time, so that you can pick out if there is anything that you have missed. Then the all important result. Yeah, as I said, that the result normally it can take up to 5 days, but usually it comes around the 2nd day. Pass result is the one which I'm sure that all of you are expecting, and I am very hopeful that with the correct training, all of you would pass your OSCE. So in order to get a pass result, you will have to pass all of the 10 stations. If unfortunately, if you fail, then the failure is divided into three types. So if you fail 1 to 7 station, then you will have to give a reset at 50% of the cost of fee for the exam, and you are only going to be resetting the same station which you have failed. So if you failed in say 3 stations, so you will need to appear only for those 3 stations, and it is going to be the same scenario that you are going to be getting. If you fail 8 to 10 station, then also you can take the reset, but you will require to pay 100% of the fees. And still you will be getting the same 10 stations which you have failed. Yeah. A full fail is someone who has failed 3 times. So you get 3 attempts to pass the OSCE. If someone has failed in all 3 attempts, then that says that it is a full fail, and then your application is closed, and you will have to wait for 6 months to restart a new application, and then you will have the new set of 3 attempts that you are going to get. So let's hope that none of you reach that level and all of you pass in the first attempt, or if unfortunately not in the first, then definitely in the second attempt, all of you pass. Okay, so some general tips. Stay calm. Very, very important to control your nervousness, because most of the time it is you make silly mistakes when you are nervous. So please stay calm. Practice, practice, and more practice, because nothing can replace practice. Then read the scenario and instructions properly. Time management. Verbalize any mistake. So if in the during your exam, if you realize that you have made some mistake, then please make sure that you verbalize that mistake. Tell the examiner that you have made the mistake and how you are going to rectify that mistake. Self-care again is very important. Make sure that you have rested well before the exam, you have hydrated yourself properly, and you have had something to eat, because empty stomach, you will lack energy and glucose. So you do need that glucose to go through the exam. So please look after yourself as well. Look presentable, but avoid anything that can cause infection. So all of you will require to be wearing your either nursing uniform or scrub or formals when you are appearing for the exam. And usually you are not allowed to wear anything which can be a risk of infection, such as like a big ring or bracelets, or any dangling earrings or necklaces and all those sort of things. And also your the hair you will need to tie so that they are above your shoulder level. Okay, so that was all about the OSCE and the new OSCE, and some introduction about that one. Now, this is a very important slide which we have come up with. And I feel that if you are able to go through this slide and follow these principles, because these are the things that you will require to do for each and every station. We call it as an introductory 6. And by introductory 6, we means that there are 6 steps that you do in order to make sure that you have a good start at any of the scenario and you do not miss out the vital information. So make sure the first step is making sure that you enter the room and it is safe for you to enter the room. Before approaching the patient, you do the hand hygiene. You first introduce yourself, that who you are and in what capacity are you going to be assessing the patient. You then confirm the patient identity before you embark on anything. Check that the patient is not allergic to anything, so that you can make sure that you are not giving anything which the patient might get a reaction to. And then you explain your purpose of your visit and gain the verbal consent from the patient. Also, about the hand hygiene, there are 7 steps of hand hygiene. Please practice those 7 steps of hand hygiene so that you are totally in practice when you go for the exam. So that is all. I know that it is a lot of information, but this is all important information. You can go through this video again if you have missed out on any of the information. But I hope that this is given you a good overview of what new OSCE is and what all are the other various aspects of the new OSCE and how you can approach the new OSCE exam. We will certainly be doing more videos for individual stations and individual sections and the skills and everything, which we are going to be doing much more in detail. So please do watch the other videos, subscribe to our channel, I hope that today's video has been really helpful. And if there is any feedback, please do give us a feedback on our channel. And this is really a happy picture of some of the candidates who have gone through us. And as you can see, all of them have passed in their first attempt, and really, really happy. This is the image that we would want to see for all of you. So thank you very much for watching today's video, and good luck for your future. Thank you.